Now, I'm a Da Vinci surgeon because it's obvious to me that this is an improvement, a paradigm shift, if you will, a leap forward in our ability to take care of our patients. And it really comes down to the bottom line. If I was going to have somebody in my own family operated on, would I want that surgeon to be trained in robotics? Yeah, I would.
I thought I was choosing between the open procedure and the laparoscopic procedure, and then she said, "Oh no, there's a third option. There's robotic surgery," and my mouth kind of dropped. I'm like, "What?"
In my research, the best option to do a nerve-sparing surgery was the Da Vinci robotic surgery. If a surgeon can see what he's doing and he can see it in a magnified resolution, I trust that he probably can do a better job.
You're dealing with nerves and blood vessels and so forth, and the idea that a surgeon can focus in, 10 to 12 times magnification, that to me was very important.
I would not have known how to opt for anything else. It wouldn't have made any sense to me. With busy lives, and women, can't put, it's harder for women, I think, nowadays to put their lives on hold.
So with the Da Vinci procedure, it was an outpatient procedure, meaning I'm in and out the same day. And that also intrigued me because instead of staying in the hospital overnight or even for a few days, I knew that I can go home and rest in my own bed.
When I woke up, the first thing that occurred to me was that I didn't hurt.
4 hours after surgery, I was walking around the ward.
And I kind of went, I can't imagine I'm going to walk out of here tonight. But you know what? When 5 o'clock rolled around, I was on my feet, walking out the door. And that was, 24 hours after being on the operating table. So it was amazing to me. So I walked out of the hospital that evening and went home. And literally, I think it was within 2 days, my wife and I were out just taking a walk together on the street.
First week, I really took it easy. But, kids, they don't stop even though you have a surgery. Both my children had massive stomach bugs that first week, and I was able to care for them.
My co-workers were nurses, and they had expected Sylvia to be away from this or not able to do this. And as nurses and as women around my age, they were amazed that I was back to work in 2 weeks.
So, about a week and a half after surgery, I was continent. I had no need for pads. My relationship with my wife was back to normal, and I had no idea that it would be this quick getting back to my normal functioning self. But it was that quick.
Feeling that good so quickly, I actually entered a couple of races within about 2.5 weeks of my surgery. My son then, we're very active together. He gave me the ultimate challenge. He said, "Dad, how about a marathon?" And it had been just about a month since I'd been on the operating table. It's one thing to bounce back and be able to go out and do these 10Ks and that, but a marathon takes a lot out of you. Even when you're in great conditioning, it takes a lot out of you. So I was quite surprised at how good I felt. Since that time, virtually my life has been identical to what it was before surgery.
I don't even feel that like I've had surgery. That's an amazing thing. I don't feel like I've had surgery, and I'm less than a month out.
I had no pain, I had no problem with the pregnancy at all. So it was really amazing. After 3 months of the surgery, I was able to conceive. That just kind of shows you that, yes, the fibro was the cause of me not getting pregnant, so the Da Vinci procedure actually did miracles for me.
As a nurse, I'm thinking, every woman should receive this type of care because just that diagnosis alters your life, your expectations, your future. But this makes it so much simpler to deal with.
It's a shame when you have to do any surgery. Nobody wants to go to the hospital. Nobody wants to have any surgery ever done. But if you have to have it, why not take advantage of the technology that's out there to reduce the impact that this has on your life? Because the whole goal of it is to get back to your life.